beyond. But in studio with me right now, I have Dr. Professor John Muteti, acting CEO Nakadam, as we have this conversation about alcohol and drug abuse in the country. Now, Professor, welcome to the set. And as we start having this conversation, my first question to you would be, in terms of the stats, in terms of the numbers, and according to the latest report, where are we as a country?
Thank you. We've carried out surveys, and the latest report is out for the 2022. This is a report which gives a snapshot of the situation as it is now. And we find that the use of drugs in absolute numbers has increased. Use of both alcohol and even hard drugs. And you find that something like alcohol, that is the most used and also abused drug, alcohol. Then of course we have others like hard drugs, which is heroin, bang. We also have shisha. We have other kinds of drugs which are also used by both the youth and also the older population.
So when we talk about drug abuse and the fight against it, we know the government is big in addressing especially alcohol abuse in the country. Nakadam, where do you come in and what is your role in this fight?
Thank you. Nakadam is an authority which has been set up by government to look at the fight against alcohol and drug abuse from the perspective of demand and also supply. Demand in the sense that we want to educate the public so that the use of alcohol and drugs goes down. So we do public education, we do advocacy, we do capacity building, we tell basically the population, including the youth, that the use of drugs, use of alcohol is not good. We give them education. But we also are mandated to carry out supply suppression, where we now carry out, issues to do with the enforcement and compliance to the law, because the law also brings out several issues as far as the use of alcohol is concerned. For example, the opening hours, the not sell to people under the age of 18, not to have establishments which are near institutions of basic learning, and quite a number of such kind of laws which we are supposed to enforce as an authority.
Now, according to the 2022 survey by Nakadam, it has been found that in localities, communities that have more numbers of, say, bars tend to consume more. So as we talk about this, how is Nakadam coming in to make sure that this is checked?
Of course, they are quite different kinds of. You see, when we did our survey, we find that different communities, different regions have different problems.
Yes.
Of course, when you go, for example, to areas like Central Province, the Central Region rather,
yes,
you find that the most abused kind of alcohol is the potable spirits. Potable spirits are, it's just, ethanol mixed with water, and it is dangerous, it's lethal, actually. And that's why you find the problem is more pronounced in Central in terms of addiction, and even in terms of the effect. The effect is far much more dangerous because we are just getting ethanol in its pure form and mixing it with water. And what you get is a little drink. When you go to Western, for example, you find that actually alcohol is most consumed in Western as far as the whole country is concerned. But the kind of alcohol consumed in Western is actually the traditional brews. It's actually the busa. And they are not as lethal. But of course they are not good, but they are not as lethal. Then you find that regions like the coast, it's now more of the heroin, the hard drugs, other regions you find it's also smoking, So Nairobi you find shisha and also some of the hard drugs also.
And when you talk about shisha, to be specific, I remember there's a time that a ban was put in place and they were not supposed to be sold. They were not supposed to even appear in these bars, but we keep seeing them. So where are we failing with regard to making sure that the law regulations are implemented?
You know, shisha, it's not that it was, the shisha has been banned since 2017. It is illegal to sell shisha, even to, you know, import the shisha bongs, the ones which, you know, are used for the smoking. What has happened is that, you see, these high-end, these upmarket joints, you know, are the ones who have actually been disregarding the law. And I must admit that I think the problem is the laxity in enforcement. And usually, and this is the fact of the matter, the people who are supposed to really enforce, including the police, might not be doing it as hard as it should be done. And therefore, you find that they know that shisha is being sold in a particular pub, but they would disregard, or they maybe based on corruption. I think most of these things, by the way, are corruption-based. In Kenya, the challenge we have is that we don't bring out some of these issues. And so if the police is there, and the police is always around that place, and they know all these, you know, places which these things are sold, why don't they just act? You know, as Nakada, we are supposed to use the police. But and if we want to go to take action in a particular establishment, we have to get the local police so that they accompany us. Although now that is being relooked, because we want to have, it's important that we have our own capacity in terms of police so that we can act even independently without all this. So we are saying that we need to work as one. You know, the police and all these other institutions, law enforcement institutions. That way we can now enforce the law as it is. But working independently, you know, for all these institutions, you'll find will be difficult.
Now, Prof, the government has been huge in fighting alcohol and drug abuse. Just this weekend, it is sad that in Migori County, they were burying around 8 people who died because of consuming illicit alcohol. And Deputy President Rigathi Gachagua is big on fighting alcohol abuse mostly. And in this intervention by the government, has it borne any fruit? Is there anything tangible that you can say as a country, as Nakada, the government coming through has helped us to a certain extent?
Oh yeah, sure. You see, the effort by the Deputy President, I must say, has borne fruit. The Deputy President started with the Centro. He met the security, agencies, including, the local leadership, the political leadership, and there were several resolutions which were made. The county governments in terms of licensing, the security, chiefs in terms of enforcement, and even the chiefs and the sub-chiefs, they were given ultimatum because and the same thing continues, as I was talking about. The chief and the assistant chief is the person on the ground. How would they not know that there is somebody who is doing some illegal brewing if they are waking up there every morning? They must know. And I think through the effort of the Deputy President, we have seen a drastic reduction of the illegal brews, in Centro, actually up to 60-70%. After Centro, the Deputy President went to Rift Valley, and he had the same kind of meeting with the security, agencies and the governors and the political leadership, and the resolutions were made, and again efforts are bearing fruit. Then, of course, he went to Eastern region, to Chuka, and he was going around the country. He'll be to Mombasa, he'll be to Western, he'll be to every part of this country, and I'm sure that through his effort, a lot will be done. And as Nakada, we are also joining the same fight to support the Deputy President.
But someone would beg to ask that now you'd find that the regional administrators, that is the chiefs, the local, the deputy assistant chiefs, would now act because they have been given the express orders to act. But how then do we come together as the government, as local communities, as Nakada, to make sure that this fight is not only for a short period, but it is sustained in the long run?
Yeah, that's very important. That's very important because, you know, you can go out there and do all this kind of what we are doing and it will be short-lived. I think the solution lies in empowering the communities, the communities themselves, so that they know if there are issues, what can they do? And we are doing that, you know, Nakada is doing that by, you know, bringing in what we are calling community coalition forums. So that in a particular community, there is a group of stakeholders, the church is there, the chief is there, the religious leaders are there, the community members, the police, and everybody involved, you know, in the community in one way or the other is there. So that they can now sort out the problems from that level. If they know there's somebody who is doing brewing illegally, they can bring out the issue and it can be sorted on the ground, you know, instead of relying on people coming out from elsewhere. And I think those community, you know, forums, if the community is empowered, it will really, you know, have a lot of impact. And that is what we are going to roll out in the next few, you know, weeks or months. And I think that that will be a good step.
Now, Prof, let's talk about two categories in this fight. Now, there is the fight against illicit alcohol that, according to your words, you say is lethal out there. But we see everyday mushrooming of bars across the country. So then how do we focus on both sides? Even if it's illegal business, how do we make sure that we look at the numbers, the opening hours, we know the Mutudo, the famous Mutudo laws, that we abide by the law, and also make sure that the importation of methanol follow the right law and they end up into the right hands?
Yeah, thank you. You know the legal bars, the beers and so on are not any better because they are the ones who also flout the laws and the regulations. You find that if it's opening hours, they are supposed to open depending on the kind of license you get. They are supposed to open during specific timings, but they don't. You know, and you see even there are many other regulations and laws which govern this industry. In most cases, these are flouted. Now, what we want to do is to make sure that we work with county governments because the licensing, mandate for the outlets is for the local, for the county governments. We work with them to make sure that when they are giving out licenses, they make sure that these outlets meet the criteria as it is in law. And then you find that if it is also, they meet this criteria, then what it means is that we will be able to say this bar, this outlet is near a learning institution, so there is no license. This bar is supposed to open at 5, and therefore, if it opens at 2, then there will be sanctions and this bar should be closed. And that should not just be done by the county governments. It should be done by a multi-agency kind of outfit so that, it is not left just to one agency. Because the moment you leave it to one agency, there will be a lot of risks involved, corruption, rent seeking and all these kind of things. So the thing is to have a multi-agency approach to this kind of thing. And I think that would really bear fruit.
Now let's talk about smoking, tobacco out there. It is said to be one of the highly and most abused drug out there. And as we talk about tobacco smoking, we find that even on the packet itself, there is a sign that you could die. There's a skull there, but people tend to still go and buy to smoke. Why are we there? Well, smoking, by the way, for your information, smoking, the tobacco smoking in Kenya has gone drastically down after the new tobacco laws were enforced. We have seen a drastic reduction in tobacco smoking. The warning signs, of course, are meant to prompt people, and especially the young people who are yet not hooked in smoking, to know that there are dangers. So it is important to give the true fact
that smoking kills, it causes cancer, it causes many, many other diseases. And therefore, people are supposed to take those warnings seriously. And also the cost implication, because we are supposed to make this as expensive as possible. Because research has shown that the more expensive you make these substances like cigarettes, the more, the more reduction in consumption there is. And this has been proven worldwide.
Now, as Nakada and the good work that you're doing on ground, what are some of the challenges that you're facing? And on that, let me just add, how easy is it for Nakada to address the young people and convince them to stop using illegal substances?
Thank you. Of course, the challenge is, one of the biggest challenges is the perception which the young people are out there. That, for example, smoking bang is fashionable, which is a myth, or it makes you more intelligent, it makes you, more hyper. Some of these myths, we are trying to debunk, we are trying to tell the youth, these are just myths. There's no truth in this. It's not fashionable to smoke bang. Neither is it fashionable to even smoke cigarettes or even to take any kind of alcohol. So it is the perception we need to change about the youth. And we are doing this through public education, through forums where we are talking to the youth and giving them the correct information. And we are telling all our stakeholders, this is the way to go. Because, maybe it is our, the value system. Our system is such that it seems to be lenient and condoning and, thinking that this is just a normal. And it's no longer normal. It's not normal. Other countries are shifting away from smoking, from taking a lot of beers and all this. They are shifting. And Kenya, if we don't want to be left behind.
So, Prof, on that note, then, two final questions for you. How do we win this fight? And also on the same, what is your strategic plan moving forward?
Now, I think the best way to win this fight is to bring everybody on board, to bring the youth, so that they can see, to bring in the youth, to bring in the faith-based organizations, to bring in government institutions, to bring in the media like you, so that you can be able to tell the people the facts as they are, and to bring everybody. This is not a fight for one individual. This is a fight for everybody. And you see the cost implication in terms of the economy, laws, and all this, which these drugs bring in, is too huge. It's too huge. And therefore, if we have to have a nation which is health, it must be sober. So we need a Kenya which is sober, so that we can have a healthy nation. And if we have a healthy nation, then obviously the economy is going. We are going to have a labor, force which is health, and it's the same thing. It goes round and round and round, and therefore you can see that it is a fight which is worth fighting, because it will give fruits to the country as a whole.
Briefly on your strategic plan.
Now, we are now coming up with a strategy where we are now going to be more on enforcement, as we tell the people, the public, the dangers of smoking, the dangers of taking this dangerous alcohol. We are also talking of enforcement, and therefore we are going to be very hard on enforcement, so that everybody follows the law. And that is why we are now saying we have that kind of action which we are going to be taking in terms of shisha smoking, those who are smoking shisha, in terms of bang, and we are going to be using the police, we are going to be using the narcotic police units, we are going to be getting intelligence, we are going to be using the nyumba kumi, we are going to be using the community, and all this is going to really bear fruit, because we are going to be very hard on enforcement and compliance, so that people comply to the law. And that's our strategy going forward.
And Professor, we also welcome you to continue championing this message through us, because we are the eye of the society. That is Professor John Muteti, acting CEO Nakada, he says that smoking, drinking is not fashionable, that we need a sober country for us to be able to champion our economic values, move forward, and become better people in the society. He says that other nations are moving away from drinking and smoking. Kenya should not be left behind. My name is Dennis.